we are who you should see if there is pain. A
Yes.
personal trainer is not trained to know how to handle that.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
Welcome to Neuro Wellness Conversations, where clinical insight meets lived experience. We're two physical therapists having real conversations about neurologic wellness, nervous system health, and what it takes to support both in everyday life. And today we're going to talk about one of the most common questions people ask when they want to move better. Should I hire a personal trainer or see a physical therapist? And as two PTs, we promise that this won't be biased. So Dr. Lewis, what are your thoughts on that?
I don't know. I think I might be a little biased, so
I'm with you on that.
I think it's a excellent topic. I think it's going to be pretty interesting to discuss it and give some people the perspectives that I think they don't really think about sometimes when they think about physical therapists versus trainers, which we kind of get, we have to address quite a bit, I think, as physical therapists.
We do. I mean, our education is a little more in depth than a personal trainer. I'm not knocking a personal trainer. They do add value to, clients, their clients that they see. But we do have a lot more in-depth education. And
Absolutely.
sometimes I feel like we get the short end of the stick. I'm just going to be honest.
Absolutely. I think a lot of times we get the short end of the stick if we were to be real about it.
Absolutely. So let's talk about what personal trainers do.
Yes.
So they are really good at motivating their clients. They focus on strength training.
Yep.
A lot on weight loss.
Yes.
And also fitness accountability, which is all well and good because I feel like clients do need that to continue on.
Absolutely. Personal trainers are a valuable entity. They play a significant role for a lot of our patients, especially after they've had physical therapy. So we're not negating their importance by any means with our discussion today. Because a personal trainer, they can really help a person understand what their relationship with exercise should be. They're going to facilitate a good program and help them to kind of garner their way towards those things that you just mentioned, strength, weight loss, fitness, and having somebody that can help make them accountable to a good fitness. But we also have to think about the difference between what they do and then what we do as physical therapists or PTs. So one of the things I'd like to clarify is I see people reference personal trainers as PTs with a capital P and a capital T. Now, as minor as this may be, this is actually major enough or significant enough that even the American Physical Therapy Association addressed it. And the understanding that I think a lot of people don't have as far as distinguishing the two is that a PT is a capital P, capital T, and a personal trainer is a lowercase p and a lowercase t. And the reason is because of what you mentioned earlier with regard to the education and the training between the two of us as far as our professions. So, in thinking about what we do, we mentioned the key points of a personal trainer. How about you kind of elaborate on the key points with regard to us?
So I like to explain that we are movement experts. We
Absolutely.
want to understand why you have an injury and how you're going to heal from that injury
Correct.
and provide you that education on what you need to do so that you can get back to your normal function.
Correct.
That's the biggest thing for me. Movement analysis. We're looking at how you walk. And I'm so bad that when I'm not working as a PT and I'm at the mall and I see
Right.
somebody walking with a cane wrong or they're walking too high, it takes me so much not to walk up to them and say, hey, can you do this? And I have to kind of refrain from it and just keep pushing.
Right. I know. I'm the same way because, we were trained to be movement detectives, so to
Yes.
speak. I remember actually specifically when I was doing my master's in physical therapy, we had to go to the mall and we had to sit and analyze people's gaits and kind of discuss it. And we paired up with like a fellow classmate, and we would sit and analyze and discuss it and talk about what we saw and what we thought was, was happening. So that's why we always want to fix somebody.
That's so true.
We are very analytical when it comes to movement.
We are.
And I think that's the difference. We are like you say, we are movement specialists. And in order to be able to specialize in movement, you've got to be pretty astute at analyzing that movement.
Absolutely.
And knowing how to help improve impaired movement as well as, injuries, knowing how to help somebody recover and rehab from injury or being better when it comes to their pain, which I think sometimes I think that's also one of the biggest differences that people don't understand. We are who you should see if there is pain. A personal trainer is not trained to know how to handle that.
Correct.
They are trained to facilitate your movement, but not movement with pain. So if you are trying to reference a personal trainer in that regard, that's where, that person is referencing the wrong professional.
That is correct.
Yeah.
And the other thing about us as physical therapists is we have specialties. We have the neurologic specialty. So if someone had a stroke or Parkinson's, we have a little more knowledge in how to help those people with movement disorders. We have women's health, pelvic health, wound care, sports, orthopedic. So there's so many other specialties and things that we literally study and help you regain your function.
Right. Yeah. Yeah. And I think I find that is something that I'm constantly educating my patients on when they come into the clinic, because they don't really understand that physical therapy is so gross and I tell them, I said, listen, this is a world in which you've got specialized physicians. And so just like you've got specialized physicians, you've got specialized physical therapists. So it's important for them to understand that sports med physical therapist is probably not the best person to go to if you've had a stroke or if you've got MS or a brain injury, So they can advise you on exercise by far, but they're not the best advisors with regard to how you can best maximize your movement with the chronic condition that you have or the diagnoses that you have. So They can tell you how to squat. They can't necessarily.
That is very true. And we
Right.
do deal with a lot more of complex patients. They have
Yes.
had a stroke, but then they have a balance issue. They may have diabetes where their vision's off. Like those
Yeah.
are things we have to take into account to help this person manage.
Correct. Yeah.
So
Yeah.
having that medical background is very key to what we
Very
do.
key. Absolutely. And that's why we have the letters behind our names, and that's why we have the letters in front of our names. I know a lot of times when people hear about us being doctors, and this isn't probably another debate for another day. Some of them have issues with calling us doctors, but
Yes, they do.
we are doctors of movement.
Yes, we are.
And we are doctors of not just any movement, but movement specifically for that requires improvement based on certain diagnoses and disorders and diseases.
Hmm.
So we, contrary to what some people believe, deserve to be called Dr. Lewis and Dr. Banks. We've
Absolutely.
earned our stripes.
Yes.
So you know,
7
I
years of school.
7 years of school. That's not a little bit of schooling, and we have medical background, we have medical education, we have clinical training.
Hmm.
Um, the fitness trainer or the personal trainer, they tend to have their certifications and they have their fitness specialization. So that's the distinctive difference between our training and education and their training and education.
Correct.
So, you know, 7 years is not a small feat,
No,
and
we
it's
learned
not
the
just
entire
7 years.
body.
Say that again. I'm sorry.
I said we learned the entire body from head to toe, all the
Head to
systems,
toe,
everything.
head to toe, head to toe, head bone connected to the neck bone.
Love that.
That's right.
That. But
And then
yeah.
we also have certifications, and our certifications are
Hmm.
generally pretty extensive certifications as well.
Hmm.
And then we have to continue these certifications for the length of our practice. We have to be licensed to practice in our states. So yeah, it's no small feat to be a physical therapist.
I agree. A lot of time in school, a lot of training outside of
Right.
school.
Yeah,
I'm still doing training. I'm still
absolutely.
creating
Me
my
too.
human education credits. I
Yeah,
just completed my stroke rehab certification renewal.
I know
It's
that.
real.
I did that last year. So
No
those
joke.
hours, those hours are many.
Yes, absolutely. So yes, we have put in our time, and like Dr. Lewis said, we deserve these letters that we have in front of our name and behind our name,
There you go.
with the goal of getting people or specializing in fixing movement problems.
Correct. So interesting enough for some of our listeners probably to learn would be the difference in our not only our training but also our salaries. Personal trainers average, even though I know some that average way more than this, but they average
Mhm.
about 46,000 a year, whereas physical therapists can vary. But our average national is roughly about 95,000 a year. But when you think about our educational background, that kind of explains why that is. And because we are so medically trained, that is part of why that happens as well.
No, I totally agree. And personal trainers, like you were talking about, they actually have an advantage because all their clients are cash.
Correct.
Most times, physical therapy is seen to be covered by insurance,
Yeah.
and sometimes reimbursement isn't great. You actually do better paying cash with a personal trainer.
Yeah. Yeah. And I think this is where some of the debate comes in
Mhm.
professionally, because people are more willing, I found, to
Mhm.
pay a personal trainer for what they are asking for, and they're less willing to do the same with the physical therapist, despite the fact that we have greater knowledge when it comes to movement than the personal trainer. Now, that this is not to by any means bash or negate personal trainers.
Right.
And, you know, I love the entrepreneurial spirit of personal trainers because they are very good entrepreneurs and good at marketing and doing what they do. That I can actually say the same thing about chiropractors because they are very good at, you know, marketing, and we find a similar thing where people are more willing to pay a chiropractor cash than they are physical therapists. But I have to say that this is one of the frustrating areas for me because people are so quick to want to say, okay, what insurance do you take, or do you take my insurance?
That's the first question.
That's the first question. Yeah. And the reimbursement with physical therapy is so pathetic. Let's just put it out there.
Yes, it is.
That it's almost an embarrassment sometimes to see what insurance companies pay for patients therapy when they come to the clinic and have gotten an hour's worth of skilled clinical treatment from somebody that is like you or myself, and you see that reimbursement at the end of the day, it's almost an insult. And it's frustrating because, you know, instead of somebody saying, okay, maybe because you don't take my insurance, I will invest in myself and pay cash, they just choose not to seek the services. Yeah, because there's so many other options for them, you know. But I am an advocate for us professionally. I am one that would love to debate and have a conversation with the insurance companies on trying to get this improved, because they need to do better, not only for us as physical therapists, but they need to do better for their clients, you know.
Absolutely. And I have advocated, you know, trying to renegotiate rates with insurance, and I was not successful. So fortunately, I had to let go of the third party payer to allow my clinic to stay afloat.
Correct.
And it was hard to make that transition because I had some clients that were pretty upset.
Yeah, I'm
but
sure.
I just couldn't continue to sustain how things were going and provide the quality care I was providing. It just didn't add up.
Yeah. We have had to think about some things like that. Similarly, we still take a couple of the major insurance companies, but honestly, it's on the brink of thinking things through and thinking things out for me and my clinic as well. When I look the money coming in versus the value going out, because it's when you think about overhead and the fact that you got to keep the doors open, or you're trying to keep the doors open, and then you look at some of that reimbursement, then you're like, okay, I've got to really think things through and think things over and see what's going to be beneficial in regard to keeping some of these insurance companies as far as us accepting those clients. And I know probably be unfortunate that some choose not to or can't or cannot come because we don't have their insurance. But when you look at whether or not it makes sense for us from a financial standpoint, I can truly understand what you did, because, you know, you got to think about what's best for yourself and for in the long run, really others, you know, so that you're maximizing on providing the best service, and you don't want to become a mill. That's the other thing.
No.
Yeah, because
I couldn't handle that. My brain could not handle that.
The neuro world, that doesn't work.
No,
absolutely not work. Yeah,
seeing 2 strokes in 1 hour,
it can't happen.
Scratching my head, like I don't know how that even works.
Exactly.
But the beauty of working together with personal trainers is I often, once I get my client discharged and they're doing great, I will say, hey, I'm going to refer you to this personal trainer.
Absolutely.
You can go to the gym now because you're not in pain, your movement is way better, and now
Absolutely.
you can go to the personal trainer to maintain your gains.
Yeah. Yeah. Because it's all about collaboration in the long run for the benefit of the patient. I know in a couple of instances for me, once the patient was through with physical therapy, then they told me that they wanted to go back to the gym and they were considering, working with a trainer. I always told them, please have the trainer communicate with me and reach out to me, and I can let them know, of course, with the patient's permission, what I thought would be a good recommendation as far as some of the things that they know to do, they needed to be able to do, or would work best for them based on why they came to see us. Yeah, it's a collaboration that helps the patient to maintain the gains that they made with physical therapy. So yeah, we pass the baton. Absolutely.
Absolutely. That's the way to do it.
Yeah.
And then if something happens, we also educate the patient and say, okay, if you got hurt or something happened and you're not moving as well, then you come back to
Right.
physical therapy.
There
Don't
you
stay
go.
with the personal trainer because
Hey,
they can help you move, but they're not going to understand the injury as
right.
easy as we do. So
Yeah. And the smart trainer will actually tell the
yes.
I know there are a few that I haven't personally met, but I've had a few of my patients come to me because the trainer told them that that was outside of the realm of their scope of practice. And so they ended up seeking physical therapy because of what the trainer said. So there are some great trainers out there that, believe in the collaboration as well. And we applaud them. Hats off to them.
Absolutely. I love that.
Yeah. So
So go ahead.
the real winners are the people that know how to use us both.
That's it.
Yeah.
Exactly. That's it exactly. So let's talk a little bit about the neural perspective.
Ooh,
So
the fun part.
the fun part, yes. I like retraining the brain. I like to describe it like that
Yeah,
because most people don't understand what the neural perspective really entails. But
absolutely.
our brains can be rewired. Even at
Yes.
an old age, we can retrain
Yep.
the brain to do things that we wanted to do, but we have to
Absolutely.
be intentional and be willing to want to do whatever that task is that you want to do.
Right.
And it's our
Yeah,
job to make it fun, creative, and challenging at the same time so that you
exactly.
literally get back to what you want to do.
Yes. Yep. Yeah, neuro is I think, and I'm biased, the best.
Get the best of both worlds because neuro and musculoskeletal work together.
Work together. And that's what I educate people on all the time. Every day I'm in the clinic, I'm teaching them. I said, you cannot have movement without nerves, and the nerves need the muscles. So that's hence neuromuscular and neuromusculoskeletal, because you have to have those muscles and bones supporting each other. So yeah, we get the best of both worlds. I can still show you exercise similarly to the orthopedic and sports physical therapists. And so it helps us to understand that we can make things fun despite the fact that the diagnosis is a little bit more complex. I love working with my stroke and Parkinson's population for that same reason, because they come in, first of all, having to mentally and physically deal with the physical changes that are starting to happen, and then having to have some kind of break it down to them to let them know, okay, this is where we're going to really have some fun and challenge you and challenge the brain, like you say, and challenge the body physically, and help work on that brain change that needs to happen so the physical change can happen as well. So yeah, we have the best of both worlds. I think that really sums it up.
We really do. And I like working. I couldn't say this at first at the beginning of my career, but now that I've worked with so many vestibular and vertical patients, people with dizziness, it's
Yes.
kind of interesting when I get cases to figure out what ear is affected, what canal is the crystal in, and which
Correct.
maneuver do I need to do to make this person feel better.
Yeah.
And the
Yeah.
beauty of it is I've gotten people, basically healed in like 2 visits. And they're
Two
like,
visits. Yeah. That's
wow,
a, oh yeah. Vestibular. It was early on. I was kind of a little nervous about it too, and then I started to find some love in the vestibular cases as well. Yeah. I
really
have to
cool.
agree. I have to agree with you on that one.
Yes. And now they have goggles. I have these goggles where the patient can put it on and we can see what their eyes are doing with head movement.
Yes.
And it's just
Yeah.
really cool.
Oh
Just
yeah.
really,
It's impressive to them as well.
yes, it is. It's like nobody else has ever, introduced this machinery, and they're like, "What is this?" And I'm like, "I'm going to show you. Well, I'm actually
Yeah.
going to record what your eyes are doing when you roll or you move your head."
Right.
And they're like blown away, and I'm like, "This is what
Yeah.
we do."
And then it helps, the balance component of it all as well is pretty significant too.
Yes,
Have when you get somebody that's coming in to see you who's falling, you get them to that point where they're no longer falling. They're walking without a cane. They're walking without a walker. They're confident.
correct.
Chest up, shoulders back, head
Yeah,
up, posturally. You just love it.
yes,
No better feeling as a physical therapist to see that patient come in with an assistive device and then walk out with nothing.
it's
you know,
awesome feeling.
and they're walking around the community and they're strutting their stuff and they're doing their thing. And, the swag is back.
Love that. So yes,
So,
changes the brain, not just the body.
not just the body. That's right.
I
That's
want
it.
our listeners to take heed to that. Exercise
Absolutely.
changes the brain,
That's it.
not
Not
just the body.
That's the motto for the night, ladies and gentlemen.
So the question isn't PT versus personal trainer. It's knowing which one you need at the right time.
There you go. That's
That's
it.
what I want you guys to take away tonight.
That's right. And that's the call to action, understanding the difference and knowing, like you say, which one they need at that particular time.
Absolutely. And if you enjoyed this episode of Neuro Wellness Conversations, follow us on YouTube, Spotify, and Apple Podcasts.
Great conversation.
Yes, it was wonderful. Until next time.
Until next time. Thank you for listening to Neuro Wellness Conversations, where clinical insight meets lived experience. If today's conversation resonated with you, share this episode with someone who could benefit. Be sure to subscribe so you don't miss future conversations on neurologic wellness and nervous system health. Until next time, keep supporting the nervous system that supports you.
Let's have a conversation about cognitive decline.